What is status epilepticus? When to call 911? Status epilepticus is a serious medical condition that requires immediate attention. It occurs when a seizure lasts longer than 5 minutes or when a person has multiple seizures in a row without regaining consciousness in between. This condition involves abnormal electrical activity in the brain that can affect both mental and physical functions. Seizures can be convulsive, meaning there are visible jerking or stiffening movements, or non-convulsive, where the person may seem confused or have a blank stare without obvious convulsions. Recognizing the symptoms of status epilepticus is crucial. These symptoms can include continuous jerking movements, stiff limbs, loss of consciousness, confusion, unusual sounds, difficulty breathing, and loss of bladder or bowel control. In cases of non-convulsive status epilepticus, the person may appear confused or spacey and may have trouble speaking. It is essential to call 911 immediately if you notice any of the following situations. If a seizure lasts longer than 5 minutes, or if the person has multiple seizures without regaining consciousness, you should seek emergency help. Additionally, if the person has difficulty breathing or shows signs of distress, that is another reason to call for help. If the seizure occurs in someone who is injured, pregnant, diabetic, or has no history of seizures, it is also critical to call 911. Lastly, if any prescribed emergency medications do not stop the seizure, do not hesitate to seek emergency assistance. If you find yourself at home during a prolonged seizure, your first step should be to protect the person from injury. Place them on a safe surface and turn them onto their side to keep their airway clear. Timing the seizure is important, and if it lasts longer than 5 minutes or if rescue medications do not work, call 911 right away. In a hospital setting, treatment for status epilepticus often includes medications such as benzodiazepines and other anti-epileptic drugs to stop the seizure activity. Medical professionals will also monitor vital signs and brain activity closely. Status epilepticus is rare but can be more common in young children and elderly adults. It can be triggered by various factors, including epilepsy, brain infections, metabolic issues, head injuries, or withdrawal from alcohol. Recognizing and treating this condition quickly is vital to reduce the risk of long-term brain damage or even death. To sum it up, status epilepticus is a medical emergency that requires urgent care. Knowing when to call 911 can make a significant difference in the outcome for someone experiencing this serious condition.